Good afternoon, everyone, and welcome to today's webinar, MedTech Connect Benefits and Best Practices. My name is Wendy Szyminski, Senior Vice President of Conference and Events for AdvaMed. Before I introduce the panelists and kick off today's session, I'd like to announce a handful of housekeeping items before we get started. First, please ensure that your speaker is on mute so it doesn't cause any background noise. Second, there will be a Q&A portion at the end. Please type your questions into the questions area within the control panel to the right of your screen, and we'll respond to those at the end. And lastly, today's webinar recording and PowerPoint slides will be made available on the MedTech Conference website. With that, it's my pleasure to introduce today's panelists. Tritt Garg from Health Quest Capital, Chris Yoakum, Strategic Advisor to Hoya, and Willie Reeves, Director of Partnering and Products and Services. And again, my name is Wendy Szyminski. Thank you all for participating in today's webinar. Tritt, I'd like to start with you if that's okay. You're both a physician and an investor, and in addition to your work at Health Quest Capital, you've published more than 20 peer-reviewed articles in preeminent journals, and I think that you were once on the Forbes 30 Under 30 list. Do I have that right?
That's right. Thanks.
Can you tell me a little bit more about your role at Health Quest Capital?
So Health Quest Capital, as you may know, is a healthcare-focused venture growth equity fund where we invest in companies across the healthcare space. Medical devices, diagnostics, healthcare IT services, pharma, so long as the principal asset is FDA approved and is revenue stage. So, we look for high growth companies. And so my role at Health Quest Capital is I'm on the investment team, and the role includes sourcing opportunities, diligencing opportunities, closing deals, and then managing deals as they are in our portfolio.
That's great. Well, and for our viewers today, Tritt and I chatted last week, and he agreed for us to share some specifics about his partnering experience during the conference.
Yep.
So I really wasn't exaggerating when I've told a couple people internally that you were a power user. You had over 40 meetings during the 2018 MedTech conference. Can you talk to me about the story behind the numbers?
Yeah, we look to participating in this conference every year just because we think it's a phenomenal opportunity to, meet with potential companies that are interesting, that are of high growth. I think AdvaMed and the MedTech conference provide a really good platform to make that happen, especially through this, connecting kind of software. And it's, given it's how, it's super easy to use and it's efficient. I was able to reach out to several companies that I thought would be a good fit, or companies reaching out to me and beginning a dialogue and continuing that over the conference through a meeting.
That's phenomenal. We're so glad that you've been utilizing the system and have had great success and that you're willing to talk about your experience today. Chris, you, of course, we've known each other for years, and I consider you an expert on partnering tools as well. Can you tell us a little bit about your background?
Sure, Wendy, and thanks for the invitation to join Tritt in sharing our expertise and experiences at the MedTech conference and with the MedTech Connect system. I was fortunate enough to spend my career in biopharma, and I had I retired from AstraZeneca after 35 years. During that career, I was one of the original, I'd say, volunteers who started working on web-enabled partnering systems, dating back to 1999 when about the time the internet launched. And so I have been involved with a number of these things over my entire career. One of the fascinating things, I think, is the fact that these systems have become so sophisticated and yet so easy to use that they are a real enabler of business development. and they can make our times at partnering conferences and such much more efficient. Currently, I'm an advisor to Hoya, which is a large global high-tech and medical device company based in Tokyo, and I've been helping them at their event at MedTech conference for the past 4 years. And we also have been engaged in quite a number of meetings with potential partners, as well as their corporate venture group that's looking for early stage investments.
I mean, I knew when we were talking about doing a webinar like this that inviting you to participate would be so incredibly beneficial. I know one of the pieces of feedback that I received last year is a lot of people feel like the conference is a manageable size where they're able to set up meetings much closer to the event. You and I have always chatted about how important it is to use MedTech Connect as part of the planning process for the MedTech conference. Can you tell me a little bit about have you already updated your profile in this year's system? What are you doing right now?
You bet I have. I logged into the system first thing this morning to update the Hoya company profile. And I already saw a great enhancement to the system from Willie and the team that the folks will be hearing from shortly, and that is to clearly identify the areas of partnering interest as first and second priority areas, and I've done that already. I'm looking forward to using the search feature to look for companies, technologies that align with the interests of my client, and eager to get started. It's really important to engage the system very early, and in order to make yourself visible, to populate your company profile. And lastly, I'd say I consider it really important to also populate your personal profile, because this is about meetings between individuals. It's not about meetings between companies per se. And it's really good to make yourself visible and to know who you're going to be, to personalize it, and so you'll know who you'll be interacting with.
That's really helpful advice. Willie, why don't we move forward and talk about some of the core features? Willie, you are the technical expert, so why don't you walk our participants through the system?
Absolutely, Wendy, and thanks for that, Chris. Trit, also thanks to both of you for all of your expertise and for sharing that with us today on the webinar. Let's jump right into some of the core features of MedTech Connect and how it will help you to maximize your time and your experience at the MedTech conference. A couple of the differentiating features of the system are, first, that the meeting requests are on a company-to-company basis. And Chris was talking a little bit about this just a moment ago. While the meetings naturally are happening between individual people, the requests are sent from one company to another. And the reason is that it allows colleagues to collaborate really easily on meeting requests. Let's say that if Wendy sends a meeting request to another company, she may want another colleague. She may want Kim to join that particular meeting. You can easily go in and kind of have equal opportunity access with all of your colleagues into the system. On that note, when you're sending meeting requests, do be aware that we encourage you to look at that other company's profile and see who might be the most relevant person or people to meet with, and throw their names into the meeting request. But do know that the other company is going to be ultimately the one to choose the parties with whom you'll meet. A second item, which Chris also mentioned, is the easy to use user interface. And we have actually added some brand new features this year for MedTech Connect, and I'll talk more about those a bit later, that will help you drill down even more efficiently and quickly to get to those companies of interest. And third, and this is probably most people's favorite feature, I think, out of at least this list, is that the meetings get scheduled by the auto scheduler. So all of that going back and forth, emails, spreadsheets, does Tuesday work for you? All of that goes away. All you have to do in MedTech Connect is mark your calendar availability and say when you're open to take meetings, and the auto scheduler will do the work of finding the time and the meeting location for you. Chris, Tritt, do you have anything to add for any of these 3 points here?
Well, I'll just mention that I've also updated my calendar and I've opened every single meeting slot to make it as easy as possible for someone to meet with Hoya.
Perfect.
Yeah, likewise.
Excellent. Well, let's jump really quickly to a quick note, and that is that we are going to have a question and answer session at the end of the webinar. So as you're going through the webinar, attendees, and as we get closer to the end, you can use the questions panel on your GoToWebinar toolbar to send questions over to the speakers. If any particular question should be sent to a certain speaker, please throw their name right into your question, and we will triage those on our end. All right, now let's take a tour of MedTech Connect. The first thing you'll see after you receive your login credentials, which you'll get within 2 business days of registering for full access at the conference, is the login page. So once you've created your password, you just log in here. We thank Viva for the sponsorship as well. And you will be taken to the home page. Now, this is kind of the landing page when you first log in that you'll always see. And there are a couple of things that we should focus on here. On the left side is an overview of all of the delegates from your company. So as Chris was saying, fill out those delegate profiles. Click on yourself here, add your headshot, put in your job title, a little bit about your professional experience. This will really help you to be more visible from within the system. Now, if you see a colleague and it says 0 time slots by their name, that means they don't have any available time on their calendar. So you wouldn't be able to add them to a meeting and they won't be able to have any meetings scheduled. So I shoot them a note and say, hey, open up some slots. Or if they have already told you what times, you can also update those calendar slots on their behalf as well in the calendar section. Here on the homepage, you can also set up frequently run searches, and you can run your saved searches using this More button over here. And you can also access it anytime in case you forget some of these steps for success or need to email us for any reason. You can find our customer service information over here on the right-hand side. One quick note again about the headshots. Headshots are really helpful to upload here because you might see someone at the welcome reception on Monday and you have a scheduled meeting with them and you say, I can't remember her name, I can't remember his name. Having the headshots in here makes that process a lot easier for those sorts of experiences on site at the conference. Now let's take a look at the notification preferences. And to access notification preferences, you go up to your profile headshot, which of course you have uploaded, and select the notification preferences item here. Now, Wendy, I know you have strong feelings about the notification preferences. We've talked about this at length. Do you have anything you want to add to this section?
I do. I think that we have a lot of people that may be using the system for the first time. And so it's a point worth emphasizing that the default setting within MedTech Connect is that all delegates will receive notifications of meeting requests. But that can be changed. So it's completely up to the individual to determine whether or not they want to receive notifications every time someone's interested in meeting with the company. So why don't you step us through how people can make those changes to their preferences?
Absolutely, Wendy. So by default, most of these notification preference switches are going to be on. This one over here on the left-hand side that says receive at this address, this is the master switch. So if you turn this off, it turns everything else off as well. By default, this is going to be on. And as Wendy mentioned, the default setting is for all delegates from a company to receive an email whenever the company receives a new meeting request. If you are a small delegation, if you're only 1 or 2 people at the conference, that may make sense for you. But if you're from a larger company, you may want to turn this new request received switch off for a while if you have a central person, for example, who is organizing all of your company's meeting requests. Now, that said, we do especially recommend leaving this one on here that says iCalendar Updates or .ics. What that is it allows the MedTech Connect system to push your scheduled meetings automatically onto your Outlook calendar. So you can have kind of copies of that information at your disposal everywhere. If you switch this off, then the system won't be able to do that anymore. So we recommend that you leave this setting turned on. Now we're going to
That's really
talk. Oh yeah, thanks, Wendy. Now we're going to talk a little bit about the MedTech Connect company profile. And for this, let's use one of our great examples of our friends at AdvaMed. So as you can see here, AdvaMed's done a great job of inputting their company's information. Important point is that this logo at the top is the company's logo, not your personal headshot. So just make sure to throw your company logo up there, not your individual face.
Willie, I think that you may need to show a different screen. I think you're in the live system.
You are right, Wendy. Thanks for that. So here you can see you can upload your company logo, not your delegate headshot. On the left-hand side, there's a section where you're able to put in tons of different information. Some of the key fields are your company type. Definitely input that. Folks are searching by company type all the time. Your brief description shows up directly in the search results. So this is kind of your very short, maybe 2-sentence elevator pitch overview of what your company does. Then you can have a more detailed company description down here as well. And below here are other fields, company objectives, your financial information, the size of your company, geographic information, your website. There's tons of info on here, and it doesn't have to take a long time to input that information, but this really makes you a lot more searchable. In the center, you can also access your services and your products. So you can add, medical devices, and there's a ton of customization that we have in there as well. And on the bottom, you can add all sorts of different content, pitch decks, presentations, YouTube videos, all of these sorts of things to your content section, which is very helpful.
So for our users that had experience with the system last year, we will just, I think it's worth noting that we have tailored the system a little bit more so you can better display your offerings. So if you had a 2018 profile, it did not automatically copy over this year. If you would like assistance or for us to import your last year's profile for previous participants, we're happy to do that. And we'll also be adding a couple new fields in late August to help you better describe your product's development cycle. Trit, can I ask you, for you, when you're looking through all of the companies that are participating in the conference, how important is the company profile and its level of detail when you're evaluating who you want to meet with at the conference?
Yeah, good question. I think for our purposes, it's extremely important because, like I mentioned, we have a pretty specific strategy in terms of companies we like to invest in, and so having a detailed profile helps someone like me kind of understand the company's stage, the company's focus, and if they'd be a good fit for HealthQuest, and so that kind of makes me more likely to reach out and schedule a meeting.
So for everyone who's interested in meeting with Trit on site, you just heard him, what you need to do to make sure that you're populating that profile correctly. So Willie, why don't we go on and talk a little bit about how to search for companies?
Absolutely, Wendy. Let's take a look at the MedTech Connect search section. And as a first quick note, I'll say here, these highlights at the top are from a bit earlier. Now that MedTech Connect has launched, we have over 1,000 delegates already in the system, over 550 companies, and more products and services as well. And those numbers continue to mount every day. As Wendy mentioned earlier, registration is going very strong this year, and we're super excited about that. Now, in the search section, the first thing to note is that there are a couple of tabs here toward the top. You can search through companies, delegates or participants, market products, and services. So a lot of people focus on the companies, which makes lots of sense, but don't forget that you can also drill down to look at specific products, specific services that may be of interest for your particular company. You can always do a basic search from right here in the basic search box, just sort of like on Google for keywords, although more powerful things are listed in the advanced search, and we'll talk about that shortly. You can save searches easily and then run those saved searches. So let's say you're the type of person that likes to block time out. You log into MedTech Connect every Monday and Thursday at noon, for instance, and you want to search for a particular type of company from a certain geographical region with a certain type of products. You can run those saved searches really easily to save time from right here. The Make a Note button is really helpful. This allows you to have a private space with the other colleagues participating from your company to make notes, discuss, is this company of interest? Does this make sense? Maybe we should take this meeting, that sort of thing. So there are lots of powerful tools here in the search section for you. But even more powerful, if you click on that advanced search button, and Wendy, I know that some folks overlook that button and kind of just use the basic text search, but we really encourage everyone to take advantage of the advanced search, and we've made a lot of changes and updates this year to make this section even more powerful for you. So you
So
can combine, yeah, go ahead,
that is,
Wendy.
I think that we should emphasize for those that are participating today. One of the benefits of us trying to really make modifications to the system to improve the experience for our users, when you take the time to invest in really building out this profile, not only will it be beneficial for you this year, but because we've made these modifications this year, that means that next year when you come back to the conference, you're going to see not only your profile come back, but you're also going to see meeting records from who you met with at the MedTech conference in 2019. So take the time, if you've already made the decision to take the time out of your calendar and participate in the conference and the investment that you make to be there, it is well worth the energy to populate the company profile in the product section.
I couldn't agree more. And to that end, once you populate that profile, people will be able, and other companies will be able to search and find you a lot more quickly. So in here, in the company section, for instance, as Chris mentioned earlier, you can look through the primary areas and those secondary areas of interest, and what are you focused on, and what is your company working on. There's a ton of helpful fields in here that really help you to drill down and find what you're looking for. One that we often hear asked about that is just below this market capitalization, it's one of the next fields, is called company registration date. And now that's very useful if you are logging into the system on a regular basis, and so you can just click on it and say, oh, show me everyone who has who's new in the system since, for example, last Monday. And MedTech Connect will show you those new companies so that you're only spending your time reviewing the latest and greatest information. We also made some changes in the products area too. So now you can search through a lot of different product types from things as specific as patient monitoring or in vitro diagnostics, surgical devices, and much more. So we really encourage you to take advantage of the advanced search to save time and help you maximize your experience at the conference. Now let's take a look at the Message Center.
So Willie, just to remind everyone, as you're looking at this message center, even though you will have an individual login to access MedTech Connect, MedTech Connect is a company message center. So any kind of inbound messages that are coming in are accessible by everyone who's registered from the company. Before we get into specifics within the Message Center, Chris, can I call on you? You often come with big companies where you have represented throughout your career, very large companies with multiple teams attending the event. Can you tell me why you feel there's an advantage to a company-based Message Center versus each individual having their own inbox?
Sure, Wendy, and give Willie a chance to catch his breath there. Um, I'm representing a global company that has currently 8 delegates registered, and we anticipate adding 2 more delegates. Those folks work all over the globe, everything from Tokyo and Singapore to the East Coast and the West Coast of the U.S. So the great thing is we're all in one company profile, coordinating and collaborating and triaging incoming meeting requests, as well as proactively reaching out to using the search function to reach out and proactively request meetings from other folks. So it's quite seamless. It's important that that we share with all of our team members that they shouldn't decline a meeting because maybe someone else might want to review it first. So we generally wait a while before we decline one, and we make sure that every incoming request has been reviewed by the different groups, whether it's the corporate venture team or the M&A team or the licensing team, so that we can be sure that if we decline a meeting, we do so knowing that we're saving the company a time slot, because it doesn't do any good to meet when something's completely outside the area of focus. So we want to be very judicious with everyone's time, and I think that's the fairest way to do it. But before Willie continues, I think I do want to emphasize that when using the system, it's really important to think to be proactive and not just reactive. The larger companies will get a lot of meeting requests, but rest assured that they're also being proactive, and they're using the system to look through your profile and see if there's anything that they might have missed or might not be aware of. The good thing about this event is there are a lot of small companies, some of whom don't have much of a presence on Google. And so putting your information in there and describing your area of technical expertise or your device is really key to securing a meeting with a potential partner. Willie, over to you.
Chris, thanks a ton for that information. I think you made some great points, and I'm going to highlight again some of those things as we walk through some pieces in the Message Center here. So let's just start from the top. If you click on the dashboard button, you can see an overview of your company's meeting request activity. So, you've got to send a report to your senior management group, and they ask what's going on, how many meetings have you got so far, how many are still outstanding to be answered. Click on the dashboard, and you can quickly answer all of those questions. On the left side, you've got some filters, so you can drill down to see the requests, for example, that are incoming and outstanding, which means that they're in the requested status still, haven't been answered yet by you. And as Chris mentioned, it's important to really be thoughtful and judicious when you're deciding whether to accept or decline a meeting request. These buttons for accept and decline, as well as all of the functions in the Message Center, are really based on your entire company. So if you decline it, if I as Willie decline a meeting request, I've declined that meeting request for everyone participating in the conference from bio. So that's why, again, we have the collaborative Message Center where you're able to work with your colleagues and decide what makes the most sense and which of these requests should get accepted. Once you decide, okay, we're interested in this company, you click accept request. As long as you've updated your calendar availability, the auto scheduler will sweep in at some point, probably that evening usually, and begin scheduling those meetings for you once scheduling starts on September 9th. So if you see some accepted meetings and they haven't been scheduled right away, don't worry. We start scheduling once we've got a critical mass of meetings so that we can schedule most effectively. Also up here, there's a tag section and tag delegates. Now we see everyone from large companies down to small startups using this. For example, let's say that I was with AdvaMed and I want to tag Wendy in this so that I bring this particular meeting request to her attention. I could just type her name in, and then when Wendy logs in, she'll be able to see that she's been sort of flagged on this meeting request. Other uses for this function are tagging by therapeutic area, or as Chris was mentioning, you may want to tag a specific team so that they know that they can go in and view those certain meeting requests that are most relevant for them. Now, one really important point that we can't underscore enough is that all of the meeting scheduling is done in accordance with mutual availability, right? There's has to be agreement and consent on both sides that there is to be a meeting in order for it to get scheduled. So once you start to have these accepted meetings and see more green in your inbox, occasionally you may see one of these red triangles that says no mutual availability. What that means is that there's not calendar overlap between everyone who's listed as a participant on that meeting. So the easy ways around that are, first, go back into your calendar, see if you can open up any more time slots. As we've been mentioning, every time slot that you open is a potential meeting. If you have 3 time slots available, you can have a maximum of 3 meetings. It's as simple as that. So we recommend that you follow Chris's lead and open up every slot that you possibly can, even open up every slot during the entire conference. A second route that you can follow is to use the reply only button. If you've got all your calendar availability open, that means that the other company must be blocking it. You can just shoot them a message to say, hey, we're still interested in meeting. Do you have any other slots that you might be able to open? And once those get accepted, the auto scheduler will sweep through and schedule those. Typically that happens in the evenings on business days.
So Willie, when once attendees arrive on site, is there still the option of changing your calendar around? Maybe I wanted to attend a session, but I've decided I'd rather open it up for meetings. Should they be off updating their availability on site as well?
That's a great question, Wendy. And yes, you absolutely can update your calendar throughout the event, including when you're on site. And as you're making those decisions on the fly and deciding which programming sessions to attend and receptions and where you want to take partnering meetings, as you make those changes inside your MedTech Connect calendar, you can first directly add any of the sessions and programming right into your calendar directly from MedTech Connect. So it saves you a lot of time there. And then secondly, as you are making those decisions about what to attend, pop back into your calendar, take 30 seconds to mark off those slots, open up new slots as those opportunities come. If a meeting gets canceled, make sure that that slot is open so that perhaps you can take another one during the same time. All right, now let's say you get to the case, it's during the conference, it's a couple of days before the conference, and you see one of these yellow flags that says pending reschedule. What that means is that someone, either from your company or from the other company, has requested to have this meeting rescheduled. So what you would do in this case, if you click the request reschedule button, which will be teal, you can always write in a preferred date and time. Please write in a preferred date and time. Our customer service team uses that to help you. If you just click that you want to have it rescheduled, we have to take a guess and we'll put it at another time. But to save everyone time and make it as efficient as possible, just say, okay, can we put this on Wednesday afternoon, for example? And then again, just make sure that that time that you want is marked as available in your calendar. Now let's take a look at some partnering pro tips. And I know that Chris and Trit have already shared some great points. And so please feel free, gentlemen, to hop in at any time on any of these points. At the high level again, so first, as we've been saying, make sure that you polish your profile. It's just like a Google search. The more terms and relevant keywords that you have listed and the more fields that you have filled out, the more likely you are to appear in search results. If you've got a blank profile, no one has anything to search on besides your company name. So give yourself and give others the opportunity to search you and find those great meeting opportunities. Start requesting meetings early. So if you wait until a week out from the MedTech conference, schedules are going to have already started to fill up. It's going to be difficult for you to get accepted meetings if you're that late in the game. So after you've registered, if you've already registered and are in the system, definitely log into MedTech Connect and start requesting those meetings now. It's more likely that you will get them accepted that way.
So Chris and Trit, I'm going to pick on you guys right now because I know that a lot of people that are participating on the webinar are thinking, but I'm really, really busy and I don't have time to do this and I'll just wait till I get on site. So, I mean, Chris, maybe you could speak to that. I mean, how important is it for you to get into the system and actively requesting meetings early?
Certainly, and I'm sure Trit has his views from his perspective. For a large company, I think you have to, if you haven't worked in a large company setting, it might be difficult to appreciate that the bigger companies actually get several hundred meeting requests, and those start coming in immediately. So if you're really looking to get a meeting with one of the large medical device companies, you need to personalize your request, explain to them why you think a meeting would be important. Look at their delegates, and as was suggested earlier, even perhaps recommend someone that you'd like to meet with. You have to simply distinguish yourself early on, because there is a filtering process that all the large companies use to triage and prioritize who they're going to meet with. Now, with respect to the company that I'm supporting, we often will target companies that we've met with in prior years so that we can get a follow-up meeting with them. And doing the meeting requests early ensures that Hoya will have the right people on the opposite side of the table from their company and from our company, that we can get those meetings into the schedule, get them confirmed, especially ones that require multiple representatives from either side or both sides, because early on is when the most people are going to have the most open time slots, and you're ensured to get that meeting. Closer to the actual conference, you're probably going to have to make decisions about who's in the meeting, because it's going to be much more challenging to find an open time slot when 3 or 4 people from one company might be available, especially on a large company. So that's why I think it's really early to start, and I can assure you, I probably spend 15 minutes of every day right now in the system, in the morning having a cup of coffee, or in the afternoon having a cup of coffee or water, and do it early and do it often.
That is such great insight. Thank you so much. I knew we made a great decision on trying to incorporate having some of our users talk about their experience. Well, I know one of the common questions that we get is, about investor participation at the conference. And it's always funny to me because, even AdvaMed, when we get meeting requests, lots of times in the subject, it'll say, can we meet? So Trit, just guessing that you get a lot of requests for meetings when you're participating in the MedTech conference. For you, how important is the subject line? Let's assume that they've got a great profile and they're personalizing the message within. How important is that subject line to get it to stand out when you're getting multiple inquiries a day?
Yeah, good question. So first of all, I'm happy to meet everyone, and I make it an effort to try to meet everybody who's reached out or I've reached out to, just because it's such a unique opportunity that we're all there together. And ultimately, investing is a relationship-driven industry, and so I encourage people to reach out, and I'm happy to take meetings. With respect to your question, I think the subject line is important, but I think the way the messages show up, it kind of tells you the company that's sending you the message, and the description is easy to access and easy to read. And to my earlier point about the description being kind of detailed, that's probably most helpful in helping me kind of triage messages and schedule meetings. But again, I really do try my best to meet as many of folks as possible.
And now along those lines, Trit, I think oftentimes and oftentimes explain it to attendees, the message center, sort of thinking of it like your Outlook inbox, right? Let's say you go into your office in the morning and you say, oh, I've got 35 new emails, and the subject line of every one of them is email. How do I tell the difference, right? You have to begin to spend more time looking and trying to figure out what's relevant. So definitely customizing those subject lines, picking out something if there's a specific product or technology that you saw on the other company's profile that you think is relevant, throw that right into the subject line so that you don't end up with a meeting request inbox, as Wendy said, that full of questions that say, let's meet and meeting requests. We all know that it's a meeting request, so you want to take advantage of that space for sure to make the most of it.
Yeah, absolutely.
Couple of related best practices here. Again, customize, 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 target, target, target. If buying a house is about location, 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 then customize is the special word for a meeting request, both in the subject line and in the message itself. Try to say specifically to that other company why you're interested in meeting with them, what appealed to you about that particular company. And I'll say, and Wendy, I know we come across this from time to time, if someone who may be newer to the system might sort of copy and paste the same request to everyone, I think it's oftentimes just like reading emails. You can sort of tell if that wasn't customized to your company. So you want to tailor it as much as possible.
I couldn't agree.
Absolutely. And then last, you just want to follow up. So if you're getting really close to the MedTech conference and you haven't heard back from a company, that meeting request is still sitting there in requested status, then you can shoot them a reply-only message from your message center, and that will both bump that message up to the top of their message center and allow you an opportunity to say, hey, we're still really interested in meeting. Hope that you will be able to accept this meeting request. Now, a couple of steps in preparing for launch, which has actually happened already. We launched and opened the MedTech Connect system up to folks, and we've got over 1,000 users in there already. But if you haven't yet registered and you're listening to this webinar, we encourage you to do that today so that you can log right into MedTech Connect and take advantage of all of these best practices. And a quick note here, if you register with a Gmail or a Yahoo or some kind of personal email address like that, you will likely get a message back from the customer support team just asking for your corporate email address. So the reason that that is done is for privacy and data security. Naturally, we want to ensure that only authorized individuals are able to get access to privileged information on meetings and other companies' message centers. Now, a couple of key dates. So yesterday on August 12th, the system launched. So we encourage you again to register if you have not yet done that. And MedTech Connect includes the programming agenda and all of the sessions and great other things that are going on during the conference. So in these coming weeks, we would encourage you to review that in your calendar and mark those sessions off, add them to your calendar. It takes about 2 clicks from within MedTech Connect, and that way you can plan your entire conference experience. And then last is September 9th, which is when accepted meetings are going to begin to be scheduled based on mutual availability. So 2 notes here. First, if you have no open time slots, and in your calendar that will appear as a big block of red, then your meetings won't be able to be scheduled. So make sure that you've got as much time open as possible. And then secondly is, and I see some questions about this in the question box, the auto scheduler is going to take care of the time and the location of the meetings for you. There's a special partnering area within the MedTech conference. So you don't have to go back and forth with the other company trying to find a date and time. As long as you've marked off that availability in your calendar, our auto scheduling algorithm will take care of that for you so you can kind of show up and have your plan all ready to go. Quick recap on the steps for success in case anyone has joined the webinar late. Create a robust, tailored company profile. Put as much info in there as you can. Keep your calendar availability updated, including during the conference. Target all of your meeting requests. Be specific to the company. You know, everyone's busy and it takes a few extra minutes sometimes to just review those profiles, but you'll get a lot better, as Chris and Trit have mentioned, you'll get a lot better return on your investment that way. And you can mention a specific person in a meeting request if you would like for a company, but that company ultimately will choose whom you will meet with on their site. And then remember to regularly log into MedTech Connect, check out all of your incoming meeting requests. And one great feature as well that we haven't yet mentioned is the ability to do post-event follow-up with other companies. So if you already have an existing meeting request with a company, the MedTech Connect system will be open for at least a year after the conference is over. So if you maybe you had so many meeting requests that you weren't able to accommodate them all during the conference, you can still use the system to follow up after the event has ended, which is really a great value add. And Wendy, I know you're super excited about this in particular. New this year, we are going to have a MedTech Connect mobile app. So the new app is going to be released in mid-September, a few weeks before the MedTech conference, and it will allow you to manage your message center on the go. You will be able to see your company's meeting requests and your calendar. You can send new meeting requests from the app. So a lot of that really great on-site key functionality you'll have right in the palm of your hand. And this app will be available for free, both for iOS devices, iPhones, as well as Androids. Wendy, anything you want to add here?
I was just going to say that when it becomes available, we will send out an email announcing that to all of our full access registrants. So you don't have to keep looking for it in the App Store. We're going to send you instructions on exactly how to download it and when you should do so.
Perfect. And we are super excited about unveiling the new app for everyone and getting your great feedback on it. All right, now we have come to time for our question and answer session. So if you're listening in on the webinar, you can use the questions box in your GoToWebinar control panel to send in questions for the speakers. And we've got quite a few here, so we're going to try to go through pretty efficiently and hit these questions. So the first one, can you send direct and personalized questions to other companies or solely meeting requests? So this is an interesting one. So MedTech Connect is designed to really facilitate those meetings, right, between different companies and different parties. If you see a company that is of interest and you want to ask them a question, you can certainly include that in your meeting request, but the core communication that's facilitated through this system is from a company to company meeting requests.
I think I'd add on to that too. The message center, you're getting a level of access to attendees that you would never be able to have in any other capacity. We do not share our attendee list. If you ever get any kind of email or offer about accessing that, except through MedTech Connect, and that's because everyone's email address is private. So anything that you're sending into that company message box is going to be viewable by all people in that company that have registered for the conference. You wouldn't want to send any confidential types of emails to an individual because it is not going directly into their inbox. It's starting out in MedTech Connect where it is available to everyone registered from the company. So that's an important distinction.
That's a great point, Wendy. Thanks for bringing that one up. Let's see here. Mark has asked, does the auto scheduler change meetings once they have been set? Good question. So generally the answer to this is no. So once a meeting has been scheduled on your calendar, it's scheduled and set to go unless you or someone from the other company requests to reschedule that meeting, in which case we'll look at that one and then reschedule it if possible. Let's see here. Does the system gate or limit the number of meetings that people can schedule? So no, not really, actually. So there's a lot of different, there are tons of time slots, actually 40 different 30-minute time slots for those 30-minute meetings during MedTech Connect across Monday through Wednesday of the event. So individually, you can have up to 40 meetings, and if each additional delegate that you bring to the conference gets their own calendar. So you can collaborate on meeting requests, or each person can take their own meeting request. That is completely up to you. But no, otherwise the system does not put in any sort of limitations on how many meetings that you can have. Let's see, we've got questions here about, is everything managed in the web portal or is there an iOS app? Yes, so there is a mobile app. There's some more detailed functions that are mainly only accessible in the web app, but the core of the message center and viewing your calendar is available in the iPhone and Android app. To whom should we direct a request to copy the company profile over from a previous year? Great question, Catherine, and we'll mention this as well in the follow-up email that includes a link to the webinar recording, but you would send that request to medtechconnect@bio.org, and we are happy to copy over that information from the 2018 conference for you. Let's see, when someone opens up extra time in his or her calendar, how can one guarantee that their meeting request is auto-scheduled? I assume many companies or people receive an overwhelming number of meeting requests, or can MedTech Connect match a request for open meetings to newly opened dates and times? This is a very detailed but very good question. So as long as that meeting has been accepted, the auto-scheduler is going to schedule it if there's mutual availability. That is its sole job. If there's not mutual availability, as we mentioned earlier, then you'll want to go and open up more calendar availability. But all of this happens in the background, so you don't have to do anything additional once the meeting is accepted and has mutual availability. And then we've got a question here about the level of activity last year, how many meetings and these sorts of things. Wendy, I'll certainly defer to you on the overall conference stats, but I know we had, I believe it was 1,680 partnering meetings with MedTech Connect. Are there any other stats that you'd like to highlight?
I think it's phenomenal that you remember that number. We do have stats on the website that provide a description of the kind of MedTech Connect activity that we had last year. That's on themedtechconference.com/medtech-connect for anyone who wants to see some of the details from last year. I also heard that we have another question about the location of the meeting. So just to be specific, the floor will open this year on Monday, and the partnering area will be directly adjacent to the exhibit floor. The plenary will also be on the exhibit floor. So you will be able to pretty much bounce between the exhibit floor, the plenary, and your MedTech Connect meetings very easily while you're on site at the conference.
Yep, thanks for clarifying that, Wendy. Let's see how many more questions that we can fit in these last few minutes here of the webinar. Can you give an example of an effective subject line? So great question, Catherine. This can really take a lot of different forms depending on what your company is and what the interests are of the other company. Chris, what is your feedback here? What kinds of subject lines are you either writing yourself, or maybe Trit, are you looking for when you're reviewing your meeting requests?
This is Chris.
Sure.
I can take a stab at that. I think that was one of the kind of the unique distinctions between Trit's approach and our approach is the types of meetings that we're looking for. Hoya is a very specialized company, so they are looking for things that align with their strategic areas of interest. And so if you look at the company profile, you'll see that they're into imaging and optics. They're also into endoscopes and laparoscopic surgical instruments. So anything that says, I have a new device that enhances endoscopy, or a new surgical instrument or something, that's going to definitely get our attention. Or if you want to be as specific as say, what stage your company's at and that you're looking for corporate venture, funding and corporate partner, that's good too, because as I mentioned earlier, we have different teams who are participating from the different business sectors of the company. Trit, over to you.
Yeah, I mean, I think to just echo some of those things, the subject line with, very brief description of which kind of sector within healthcare, I mean, device company or, cardiovascular focused device company or, neurology focused device company, with revenue or 510 clearance or some kind of, some hint at the sector within healthcare's relative stage of company is probably a great subject line for me at least.
Great, thanks.
Billy,
for that
this is
feedback,
Chris.
guys.
If I could throw in one more advice, I know there's probably some academics on the line,
Please.
and they may have an entire portfolio of things that are not narrowed down to one specific area, and that's okay too. Just put in there your request that you'd like to highlight, some of your technology disclosures and identify who the proper contacts are, for creating awareness between an academic institution and the company. And those meetings are very popular with our team and are readily accepted. So don't worry if you're representing an entire portfolio of opportunities, you can still get a meeting with the large companies.
Perfect. I think those all of those examples are perfect answers to the question of how to target, how to write those meeting requests. So we can take a couple more questions here in our last 3 to 5 minutes remaining. We have several questions related to do the confirmed meeting sync with my Outlook or Google Calendar? So yes, as long as you have your notification preferences set so that ICS option is on and that is enabled by default on the platform, then those meetings will automatically push into your Outlook calendar. If you use Google Calendar or some other kind of outside calendar, that is fine too. In the calendar section, you can just click export and download that same ICS file and import it into your Google Calendar, and it will pull all of that information over for you. Wendy, it looks like this one might be for you. Can those with exhibit-only passes request meetings, or is it restricted to those with full conference passes?
It is restricted to those with full access. Exhibitors are provided with one full access registration as part of their booth. And for any exhibitor booth personnel that would want to access, it's very easy to do. It can be done in advance or on site through the exhibitor portal. And if anyone has any more specific questions, you can always reach us at medtechconnect@bio.org to talk about adding personnel and making sure that other delegates are represented within the system.
Awesome. Thank you, Wendy. And speaking of personnel, we have a question here. When accepted meetings, can we allocate a meeting to a delegate of the team? So question, can you assign a specific delegate for a specific meeting request? Yes, at any time, you can change on your side who the delegates are participating. You can take yourself on or off of a meeting as long as someone, at least one person from your side is still left on. You can add colleagues. Again, there's equal sort of visibility and opportunity access once you're in the MedTech Connect system. So you can always add your colleague or remove someone as you need to. Let's see, does the platform send notifications on new registrants? So we don't have emails necessarily going out every time someone new registers because you'd end up with thousands of emails because the MedTech conference is so popular. But you can go into the search section, into the advanced search, and use that company registration date advanced filter to find just those new companies that have registered since you last logged into the system. And let's see here, will you be having another webinar for those who couldn't attend today? So no, there won't be another webinar, but this webinar is being recorded. So the recording will be distributed via email along with the PowerPoint slides following the webinar. And on that note, it is 1:58 p.m. So Wendy, I'm going to turn it back over to you.
Thank you, Wele. Just a reminder, if we did not cover anything today and you have further questions, you can email us at medtechconnect@bio.org, and we will be happy to cover any questions specific to the system or access anything that you need us to cover that we did not cover today. On behalf of AdvaMed, I just want to thank today's panelists, Trit, Chris, Willie. I'm always grateful when you run through the technical aspects of the system. Thank you so much for joining us on the webinar today. And for all of our participants, thank you for viewing our webinar. We hope you found the discussion valuable and are ready to start leveraging MedTech Connect.